Alright, they're on.
Good. Alright. Hey guys, we're back. Had a request from an old training partner who was dealing with a little bit of hip impingement and wanted me to kind of talk about that. So what's been happening is they're getting this pain at the front of the hip, kind of on the inside a little bit when they're right at the bottom of a squat. So when you're right down low, it's going to feel like a really sharp pinch. And what's happening is then it's giving them a problem for a couple of days afterwards. It's stiff, it's sore, it's pretty banged up. So when we talk about hip impingement, particularly at the front, and we're having that medial pain, you're thinking, oh, what's going on? Is that psoas? Is that actinius? Turns out most of the research for hip impingement relates to the IT band and the TFL being too tight, particularly the TFL. So what happens when this TFL complex off to the side is a little too tight, the hip joint, where it normally likes to rock and slide and glide, it gets pulled to the front of the joint. So again, that makes sense. That anterior muscle pulling the whole complex forward. So instead of having this nice mobile hip, all of a sudden it's right at the front of the joint, then can't quite slide before it butts up against those structures at the front of the hip. So there's a few things we can do about that. The first one we need to do is just get into that TFL. There's going to be a bit of a progression for things we can do for that. So we need to be able to find it first. So there's two basic bony landmarks we're going to find. One is just the iliac crest, just that big bony notch at the top of the hip, really easy to find. The second is your greater trochanter. So that's that bony protuberance here on the femur. So essentially, if you can find that, we're going to go right in between those two. If you can't find that one on your femur, just rotate your leg back and forth. It'll pop out easy enough. So that's where we want to go, between those 2 points. So we're going to take our lacrosse ball. Again, knowing those points, jam it right in between the two. So that's your point. You're going to lay on the ground and just dig that in there. Hunt around for anything, roll around, find any really tight spots, anything that's really nasty. Hang out, spend some time there. If that's not enough, or if you want to bump it up, make it a little harder, you can do a little active work too. Slide your leg up and down on it too. It'll feel absolutely horrible, but it's probably exactly what you need. So that's a second level up. If you need more, or you want to tackle it a little bit differently, bring that leg up. So the TFL has a rotational component to the hip, so we can give ourselves a little bit of rotation there as well. Keep working that, and you'll certainly feel it. And then what we do, test, retest. So if our problem was that pinch at the front of the hip when we're squatting, try another squat. Any difference? Does it feel any different? Is it less sore? Are you still getting that pinch? So what I've found, particularly when working with the powerlifters with this problem, is that you're shifting your weight. So the hip that's sore, or that's getting the pinch at the bottom, is often one that you're probably favoring a little too much when you're lifting. So check that out. Have your training partner check that out. Are you putting too much weight on one leg? Now the good thing about this little series of progressions is that it's a nice treat-all for a number of lower limb problems. So if you want to get your squat deeper, that's going to help. If you've got low back pain from extension, from tight hip flexors, that's going to help. If you've got any type of medial knee pain, MCL pain, if you've got any patellar problems, that whole complex here at the side of the hip where the TFL is runs down to that lateral retinaculum. You can pull that patella laterally. So runners, if you've got any ITB problems, that's going to be a good one for you as well. So guys, give that a try. Hope that helps. If you've got any other questions, fire them at me, send me a message. If you don't have my contact, find someone who does, send them a message, tell them to get it to me, and let's keep solving problems. Thanks guys.